All right. Good morning. So we have a view for test 3, which is going to include chapters 11, 12, and 13. 11, your complementary and alternative medicine. 12 is your patient teaching. And then 13 is all your safety. All right, for the patient and for the nurse and for the hospital or the facilities. All right, so chapter 11, some key things. Complementary and alternative. Need to know the difference between complementary and alternative. All right. Also need to know which is a faster for results and which one's going to take more time. So if we do 2 medications, is that faster versus doing a medication and diet, just for instance. All right, need to know the herbs from that box. All right, 11.11. And what are some benefits of these herbs? Okay, and why do people do CAM? What were the 4 reasonings that patients choose to use CAM versus the Western medicine? All right, what is a problem with herbs and medications? What can be a potential problem that us as nurses really need to be in line with, get that information from the patients to notify the physician. All right, need to be able to recognize the key terms. What is acupressure? What is acupuncture? What's the difference? And what are some concerns for patients with comorbidities when getting acupuncture? All right, the same thing with massage. What are some concerns if patients say, hey, I want to get massages, but they have this condition? So we talked about the DVTs. What's the problem if we get massages and we have DVTs? What can occur? All right, holism, need to know that definition. Okay, so there's 4. So going through the chapter, make sure you understand all the red safety points that are posted about different chiropractor, who would be concerned, massage, who would be concerned. Okay. Which medications people would be concerned about. Reflexology, you need to know that massage and what that entails. Going back to our herbs, again, recognizing patients, if they're taking different herbs and what for, what is so important that we do. Knowing different types of CAM that we can use from the end box of box 11.1, which talks about meditation. Who would you recommend to do meditation? Maybe a patient for a surgery if they were seeing a little anxious. All right, maybe get some meditation. What is play therapy? What is music therapy? And then aromatherapy. We talked about the oils. All right. Are oils still a herb, and do we still need to know? So we can use the peppermint oil. Right. Some of the herbs that we did discuss in class was our CQ10, feverfew, melatonin, peppermint, and valerian, St. John's wort. All right, so again, table 11.11 needs to be familiar with them. When we talk about complementary and alternative, let's think about that. Does it just include what's happening there, or does it include everything? Okay. If you're teaching holistic practices, what is some ways we can do nutrition? What are some things? So is artificial sweetener and diet soda considered the same? Okay. And then also talking about Okay, that's chapter 11. All right, chapter 12 is our patient teaching. Need to know visual, auditory, and kinesthetic. Need to know how to recognize that and which ones those are. Teachable moments. What is a teachable moment and what would you teach at that moment? So you need to be able to recognize box 12.1, what you're going to do. If somebody has a language barrier for teaching, who are we going to call? All right, and factors that factors that affect learning. What are those factors and how do we work with that? All right, need to know the 2 nursing diagnoses that correspond to patient teaching. Okay, deficient knowledge or enhanced readiness. So we need to be familiar with that. Why is it so important that we document teaching and who mandates that? Okay, being able to recognize different comorbidities and what type of patient teaching needs to occur with that. Okay, that's chapter 12. So basically, and how do we evaluate? What is the best way to evaluate that our patients understand our teaching? All right, and what do we do when they're not paying attention to our teaching? So again, going through, make sure you read all the boxes in the chapter, box 12.2, table 12.2, table 12.1. Need to know health promotion and a wellness strategy. What is the difference of health promotion and wellness strategies? Chapter 13 is the big one. All right, we're talking about safety, big one, okay? Need to know your key terms and been able to recognize them. What is base of support, okay? And your restraints. Need to know all your restraints, everything we've gone over with restraints, the 2 fingers, taking them off every 2 hours, checking every 30 minutes for skin integrity, moisture, okay, anything that can cause problems. What's a MSDS? What's a mass casualty event? The definition of that. Again, go through and be familiar with all the safety. Okay, what are the facts, environmental factors that makes it unsafe for a patient? The impaired mobility, the delayed assistance, and being able to recognize that in our questions. Prevention of falls, what's the scale that we use? Okay. And what do we do if a patient has fallen? Box 13.1, need to know that. What are the strategies, okay, that to help prevent falls for people who are at risk? Need to be familiar with those strategies and be able to recognize them with our patients. Okay, what report is filled out when we do have a patient fall, and how do we document that they fall in or what we seen when we walked in the room? All right, restraints, how long are they good for? Are they used as a first resort or a last resort? Can medications be considered a restraint? Safety, all the factors for safety, the tubing, IVs, any type of equipment. Fire, you need to know race, pass, types of fires and extinguishers, so box 13.2. How do we minimize, how do we keep a safe environment for nurses? That's our body mechanics, everything else. So the types of box 13.3, the types of hazards for nursing staffs. Okay, biological hazards. What are some type of biological hazards? Where do we go if we do get a biological hazard? What, we go see the occupational health department because occupational nurses work with work-related incidents. So care plans or nursing diagnosis related to falls. All right, again, and what we do. All right, so remember, you're going to think of your conditions and what could be a safety factor. So if you have diabetes, who has neuropathy, so they have impaired sensation, what are some things we're going to educate them on to maintain a safe lifestyle at home? You know, like taking that temperature when they take a shower, because they're not going to be able to feel it. Other safety things with people with orthostatic hypertension, what do we do for them? All right, remember Maslow's always is going to come into play. And then you're also going to have your ABCs when you're thinking of your questions, if it's like the multiple questions. Always remember you want to have wheels locked as part of your safety. And restraints. Well, what are some complications of restraints? What can occur? What do you do if you find the restraint that's, you see some blue tips of the fingers? What do you do? Do you just loosen it or do you take it off? What are some alternatives to restraints? What can we do to our patients who are just trying to get out of bed? All right, and then safety at the home. If you're a home health nurse and you have people and you don't want to, what would you do when you go visit the home? Okay, patient teaching. If you had to teach to a toddler, what's the best way to teach to a toddler? Okay, are they more demonstrating, using a doll to kind of help? What are one of the most common from falls that people break? What's the common area that they break from a fall? All right, hopefully this helps you. We'll do a quick review Monday morning before we take the test. Again, all the safety checks, importance of restraints, need to know everything about the restraints, the 2 fingers, the 2 hours, the 30 minutes, 24 hours. Okay, what are we checking? And we are checking our restraints. And oxygen, what's a problem with oxygen in the home? Can be a problem. What is a flammable piece of material? All right, hope this helps. Review it and ask questions.